In the United States healthcare system, the patients are supported by two separate yet equally important groups: the administrators who manage operations and policies, and the healthcare providers who deliver care and treatment. These are their stories.
I'm David Noyola with Aviana Healthcare, Executive Director of the San Antonio West branch location.
Hi, my name is Michael and I'm an orthopedic trauma surgery PA at Baylor.
Can you describe your experience working with limited English proficiency patients and their families in the healthcare system?
Yes, within the 5 years that I've been working with Aviana Healthcare, I've experienced quite a few patients that have limited English speaking capacity, ability. Due to cultural background, these patients have had an increased amount of struggles in regards to finding appropriate healthcare benefits that are able to be pursued by them.
Okay. Can you describe your experience working with limited English proficiency patients and their families in the healthcare system?
I routinely encounter patients with limited English proficiency both in the hospital and in the outpatient clinic setting. There's definitely challenging aspects that can arise when the care of patients with LEP. I think it can be frustrating from both the provider and the patient standpoint. Um, and though there's certain resources available and technologies available to help mitigate these barriers and challenges, I think they still often occur, and that's what makes this such an important healthcare issue.
From your perspective, what is the most pressing challenge LEP patients and families face when trying to access healthcare?
The majority of the time, I would say the language barrier is the biggest deterrent for them being able to adequately find and discover all the resources that are available to them. Um, the Hispanic culture is typically very proud and does not like asking for questions or help, and sometimes feel ashamed that they feel that the language barrier can be seen as a mark of not being proficient or as intelligent, which definitely isn't the case.
Can you describe your experience working with limited English proficiency patients and their families in the healthcare system?
There's multiple barriers to taking care of patients with limited English proficiency. I think they all boil down to some sort of miscommunication. I think patients sometimes are embarrassed or they have a sense of cultural pride in their language, which can sometimes lead to fear and asking a question or telling a symptom. And sometimes this leads to lack of trust between the patient and the provider. I think there can also be a poor health literacy component, um, both from the patient standpoint and the translator standpoint. Sometimes providers get caught up in using too much medical jargon or lingo, which just doesn't translate well, or sometimes the patients just don't understand, which again leads to more communication issues. I often deal with patients, in emergent scenarios, or a lot of the time it's the worst day of their life, and so I think this miscommunication definitely makes things challenging. Um, I think there's also a lack of resources. Sometimes translators and interpreters aren't always available, or just don't seem to be getting points across that you would like. And I think there's also awareness issues from medical providers and healthcare workers. Oftentimes, I see patients for their first post-op checks and their discharge papers are printed in English when we do have settings that can print them in Spanish, and maybe they would understand and know the proper instructions and care and medications that they should be taking if we just take a little bit more time and realize that, oh, let's make sure we print this in Spanish for this patient. So um, definitely a lot of barriers. I think they all boil down to miscommunication, and I think trying to find ways to improve uh, the communication between the patient and provider is very important.
How do you feel LEP patient care differs between your nursing staff versus the nurses who can speak Spanish versus the ones that can't?
I don't believe the care that is being conducted by the nurses differs. I think the tact, the bedside manner, and the overall approach and communication to the families is what differs. We do happen to have one patient in particular that the family is primarily Spanish speaking, but mom is open and available to have an English speaking nurse. So one of the ways that they overcome the hurdles of the language barrier is by utilizing technology. Google Translate and such has definitely been able to create an impact positively for this family because the nurse that they have is 100% English speaking, but the family loves her profusely and considers her a part of the family.
Okay.
And what about you with other providers?
I think there's a big difference between the care when we have a medical provider or somebody on our team that can speak Spanish or whatever the patient's native language is. It goes a long way. Studies have shown that there's increased healthcare outcomes when the patient and provider speak the same language. So if you have that availability and opportunity, you should definitely capitalize on it. It gives the patients confidence. As a provider, it gives me confidence that the patient understands their diagnosis, they understand the plan, they understand the surgery that they're about to undergo in the recovery process. Um, I don't speak Spanish. I'm not fluent by any means, but there's little things that I've picked up on. I'll introduce myself in Spanish and then get an interpreter. And I think little things like that still go a long way and give the patient a little bit of comfort and reassurance. So I think there's definitely a difference, and you definitely should capitalize on it if you have that availability.
What, as an organization healthcare leader slash manager, are you doing to address any LEP patient disparities within your company?
So one of the biggest things that we attempt to do here at this branch in particular is hire on individuals that have the capacity to be bilingual, right? To be able to bridge that gap and provide a sense of comfort for these families to be able to engage with, relate, and in the event that a Spanish speaker isn't available and present, we do happen to have access to a language line that is available 24 hours a day to be able to assist in the event of an emergency or just an in-depth conversation is needed when a true Spanish speaker is not present within the office.
There's definitely certain things that I do and that I'm growing to do in my practice when taking care of patients with limited English proficiency. Again, I'm not fluent, but I like to introduce myself in Spanish. Um, there's certain phrases or questions that I have that are common that I've learned and will use. Um, I think it gives the patient a little bit of comfort and reassurance. I obviously would love I love to use nurses or MAs or any other provider that is available that is fluent to help translate. I think again it gives me confidence. It gives the patient confidence. Um, Ultimately, the big thing that I like to do is just make sure that all their questions are answered, that they have nothing left unsaid, and that they fully understand their diagnosis, the treatment plan, and follow-up instructions to make sure that they leave confident in knowing what to do and how to take care of themselves. And I tell them that I'm always available if something else were to come up that they might have a question or a misunderstanding about. So those are the things I like to do. Eventually, I'd like to become more fluent and proficient in Spanish to help close that gap.
Do you have any other ideas or suggestions for possibly higher ups or companies that could help bridge these gaps?
Other than just overall education, right? Ensuring that we try and be as well-rounded as possible and opening ourselves to learning a language and being able to better assist our current population here in San Antonio, Texas.
Some of the ideas that have come to my mind when thinking about this topic, again, is just bringing more awareness to the issue at hand. Obviously, we have resources and things available when it comes to printing out, discharge instructions or things like that in a different language or in Spanish. I know we have certain, things on specific injuries for your shoulder, your knee, or your hip. Pamphlets about information regarding that can be printed out in any language. So I think having more of those pamphlets available for more injuries, more diseases, and then also just making sure that the providers have the awareness to print them in that language that is needed for the patient, I think will go a long way. Another thing that I've kind of stumbled upon in my own research in this topic is there are certain courses that are available for healthcare providers to learn Spanish that actually count towards their CMEs, towards their license. So I think incentivizing that, whether it's healthcare administration finding a way again to make that more available or incentivized for providers to do, or just making again more awareness that it's available for providers to have access to and to look into. It's definitely something that I've looked into and hopefully will do here in the coming future.
The LEPU continues to be dedicated in learning how we can bridge gaps with limited English proficiency patients in healthcare. Healthcare administrators and providers must take necessary steps to bridge communication gaps caused by limited English proficiency and ensuring equitable care and compliance with regulations for all.